What is survival in Parkinson's disease prior to the use of this big gun drug? The top line is life expectancy in a Parkinson's patient in the 1970s before this drug was widely used. And as you can tell, the observed progression rate, which is the bottom one, was much lower than what should have been expected in a patient. But after levodopa was instigated, this is the observed death rate, and this is the expected death rate. And as you can tell, it's really narrowed that gap. Not disappeared, but it's narrowed it. So the point is levodopa, the use of Sinemet or levodopa, absolutely improves mortality in Parkinson's disease. You'll see this slide a bunch. Levodopa over time, however, has this interesting motor complication effect. That's what I was talking to you about, it needing more and more drug to get the same effect. This is the first year in a patient with Parkinson's disease. This area under the curve is the blue area in this first little graph right here is the area that you're on without dyskinesia but without Parkinsonian symptoms, and as you can tell, it lasts quite a while. But in the second graph, where you have moderate degrees Parkinson's, the little blue window of opportunity gets more narrow, and as you go on into advanced Parkinson's, it gets even more narrow, so you have to take more and more doses of drug to achieve the same effect. If you go too high, you get dyskinesia. If you don't go too low, you're bradykinetic and Parkinsonian. We also have a way of staging progression of Parkinson's by taking the brain out and looking at it under a microscope, but we try not to do that to patients like you. But we do know that in the earliest stages of Parkinson's disease, by looking at autopsied brains of Parkinson's patients that have died of other things, that the disease actually begins way down in the brain stalk before it ever reaches the areas that cause the motor symptoms. So we do have ways of looking at that, but we try not to do autopsies on live people. Then we can look at Parkinson's disease with this PET SPECT, fluorodopa PET imaging. That does show us how the disease is progressing, but we generally reserve that for research as a marker of how disease is progressing. It's much easier to tell in you how you're progressing by looking at you in our office every day rather than depending on a scan. This is a scan of a patient with Parkinson's disease. In the early stages, as you can see in the basal ganglia, there's less red uptake of dopamine. Then you move over into the later stages and you can see there's even less. And now they're not metabolizing glucose in the cortex of the brain. That correlates to the memory cognitive dysfunction that eventually evolves in most Parkinsonian patients. We also use something called the Hone and Yar scale to assess progression. I'm sorry about the typos in this, but I couldn't find one that fit on the slide otherwise. Stage 0 is you don't have Parkinson's. Stage 1, well, at least not observable Parkinson's. Stage 1, your symptoms are just on one side. Stage 2, they're predominantly on one side, but they're causing disability. Stage 3, bilateral involvement, some postural impairment. Stage 4, severe handicap, but you're able to walk, partial loss of autonomy or independence. And stage 5, confined to a bed or wheelchair, no longer autonomous. There are other scales, the Universal Parkinson's Disease Rating Scale. We use scales like activities of daily living, quality of life, because really you can't just put a number on a patient from a motor standpoint and say, there, you're at this stage of Parkinson's. It's how Parkinson's is affecting your life. And remember, with regard to scales, and some people get obsessed with scales, if you're on medicine, the scales reflect how you're doing on medicine. If you were to go off of your medicine, it's much more likely that your stage of progression would be lower. So don't obsess over scales. I find they're really only useful in what I do to try to assess you. But in you trying to assess you, I don't think they're very helpful. They give an idea to your doctor about how to treat, what symptoms to treat, when to treat. They're very useful to us. But the scales, again, are just numbers. It really doesn't give us a whole picture about how Parkinson's is affecting your individual life. Is there any way to predict how you will progress? Well, actually there is. In fact, tremor-predominant Parkinson's disease, especially in women, that presents with a pretty heavy, horrible-looking tremor, those people tend to progress slower. Those people tend to do well. But it can be quite confusing to doctors because they aren't progressing. For instance, yesterday I had one of my colleagues call me into the room. He said, Melissa, I just don't understand this guy. He's had this tremor, a really bad tremor, and a little bit of difficulty with finger tapping for the last 7 years, and he's not progressed at all. I don't think he could have Parkinson's disease. And I said, no, he's got benign tremulous, tremor-predominant Parkinson's disease. They just slowly progress. It's a good thing to have. So I reassure my patients when they come in like this that this is actually a good sign. Now, opposed to that is the postural and gait impairment form of Parkinson's, where you present with more gait disorder, postural impairment, and also a negative sign is if you're presenting with Parkinson's disease with early dementia. Those people tend to progress faster and do worse. Younger onset tend to progress slower. Possibly this is because they compensate better, because normal aging mitigates or reduces your ability to deal with Parkinsonian symptoms. So older age tend to progress faster. But I think this is actually because they don't have as good compensatory mechanisms. Swallowing difficulty is the most important factor in determining risk for death. As I said, Parkinson's disease isn't a terminal disease. It doesn't kill you. It's the complications like difficulty swallowing, you aspirate, you get pneumonia, you end up in the hospital, you die, that sort of thing. So swallowing is a very important thing to pay attention to early in Parkinson's.